Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Your skin has secret cells you have probably never heard of. You probably think of your skin as just covering. But what if I told you it's actually alive with secret cells working non-stop to protect you? Not just skin deep. Meet the cells that protect, color, and heal you. Inside each inch of skin, there's a team of specialists. Some make pigment, some sense touch, other fight infection, or rebuild after injury. In today's video, we'll uncover the 6 key cells types that keep you alive, plus a few bonus terms every nursing student should know from Chapter 49 of Davis Advantage of Medical Surgical Nursing. So let's dive in and finally understand why your skin is so much more than just a surface. Those key terms will help you to understand exactly how the skin protects, sense, and heal, from the cell deep inside to the changes you can see on the outside. Let's start with the first one, and at the end, I will make a summary with the 6 cells, the secret cells. So the first key term is albinism, inherent absence or marked reduction of melanin pigment in skin, hair, and eyes. Causes very light coloring, photosensitivity, vision problems, and increased skin cancer risk. I'm thinking if you see through these key terms, my 6 secret cells. So it's in this list. Albino means absent melanin. Then this is very common. Alopecia, loss of hair from scalp or body, may be patchy. Areata, patterned or androgenic or diffuse. So probably from chemo or endocrine. So alopecia, a loss of hair. Apocrine, sweat glands, large scent glands in axillae, areolae, and anogenital areas that empty into hair follices. Activate at puberty, thick, milky secretion, body odor after bacteria breakdown. So apo means after puberty, armpits and ano. Then Braden scale, validated tool to predict pressure injuries, risk, sensory perception, moisture, activity, mobility, nutrition, friction, or shear. Low score equal higher risk. So if, for instance, Braden scale, it's more than 18, then it's a better risk. This will be more in outline in the next video. Cryosurgery, destruction of skin lesion by freezing, usually liquid nitrogen, used for warts, actinic keratocytes, small tumors cause blister then slough. So cryo, cold, kill. Next one, dermatoporosis, age-related skin fragility syndrome, chronic purpura, laceration, skin atrophy, delayed healing in older adults. So it's like osteoporosis of skin. Dermas, it's well known. Connective tissue layer, beneath epidermis, containing blood vessel, nerves, hair follicles, and glands, provide strength and elasticity. So the dermis is the deep, durable layer, and we do injection there. Then ecchymosis, a bruise, non-bleaching purple discoloration from blood leakage into skin or mucosa. Usually it's like no more than 1 centimeter. It's like big bruise. Next. So this is mostly like for pressure, ulcers, like if somebody has bleeding disorder or medication anticoagulants, then if touch something, it's getting a little bit bruised there. And the green sweat glands, it's a widely disturbed palm, soles, forehead, secrete watery sweat directly to skin surface for thermoregulation via vaporization. So E, it's like everywhere, so evaporation. Let me get a little bit down. Make it pretty. Epidermis, outmost avascular skin layer of stratified squamous epithelium. It's a barrier function. Contains keratinocytes, melanocytes, Merkel and Langerhans cells. So the AP is an outer layer. layer. Erythema, redness of skin from capillary dilation, inflammation, infection, sunburn, pressure. Usually bleaches with pressure. So erythro means red. Hirsutism, excess terminal hair growth in women in androgen-dependent areas, face, chest, often due to PCOS or medication. So the hair sweet, it's hairy female. Keratin, the tough, fibrous, structural protein epidermis, hair and nails that provides waterproofing and mechanical protection. So keratin is like skin Kevlar. And the next one has the cytes, which is like a cell name. Keratinocytes, predominant epidermal cells that produce keratin, arise from basal layer and move outward, forming the stratum corneum. So this is like keratin. It's making cells. Um, Langerhans cells. It's antigen presenting dendritic cells in epidermis that initiate immune responses, contact dermatitis. So L looks like lookout immune cells. Uh, Melanocytes, so it's a cell because it's sites. Pigment producing cells in basal epidermis synthesize melanin to protect against the UV radiation. So it's the melanin makers. Merkel cells, it's the mechanoreceptor cells in basal epidermis associated with light touch sensation. Origin of rare Merkel cell carcinoma. So the Merkel, it's like the touch sensor. Onycholysis is separation of nail plate from nail bed starting distantly. White lifting causes include trauma, psoriasis, fungus, thyroid disease, drugs. So onycho in the beginning here, onycho means a nail, and lysis, it's like lift. Pedicure, tiny, like smaller than 2 millimeters, non-bleachable, red, purple, pinpoint spots from capillary hemorrhage, often in thrombocytopenia. We talked about this in the previous chapter about thrombocytopenia, and signs and symptoms was pedicure. So petite pedicure is like platelets problem, and the chapter doesn't have many keywords, 25 only, so that's good. Not 45 like the previous ones. Primary lesions, initial characteristic skin changes, macule, pupule, vesicle, wheal, nodule, plaque, cyst, pustule. So this is like the primary, like frozen lesions. There are many pictures of this on the internet. Pruritus, itching sensation that provoke scarred like scratching caused by dry skin, allergy, infection, medication, or systemic disease. Sebaceous glands is the oil glands connected to hair follicles, secrete sebum to lubricate skin hair. androgen response implicated in acne. Secondary lesion, we had the primary one, and this is the secondary one, results from evolution of primary lesion or external forces like scratching, infection, healing, then scale crust, fissure, erosion, ulcer, excoriation, scar, atrophy, lichenification. So it's like next of change, a prolonged subcutaneous tissue. It's the hypodermis, adipose plus connective tissue under the dermis. Isolates, caution, energy store, route for sub-Q injection. With the sub-Q injection, here it's insulin. Vitiligo, it's accurate autoimmune loss of melanocytes, sharply demarcated the pigment molecule or patches for systematic rise. Oh my goodness. So basically it's a pigment vanishes. So the pigment is vanishing. So that's good. So let's see, which one do you think is the secret cells? So my 6 secret cells, how they work together, those 6 secret cells. So cells of the integumentary system, the skin, the 6th one, they're actually in mostly right up here in epidermis. And so the keratinocytes is the first one. So the definition is again the main cells of the epidermis. It's about 90%. They form in the basal layer and move upward, producing keratin, a tough waterproof protein. So the function is to protect against injury, pathogens, and water loss. So to keep in mind, K is to keep the water out, keeps the water out. So I don't know if you can see my mouse, but it's right here. So it's like shows the starket layers from the new cell's top dead protective shield. So it goes from the top up. Then number 2 is the melanocytes. The melanocytes is the pigment producing cells in the basal layer of the epidermis. They make melanin, which gives skin, hair, and eyes their color. A function is that it shields the nucleus from UV damage, the natural sunscreen. So the critical tie in it's a loss which leads to vitiligo, we talked about. Overactivity leads to melasma or tanning. So think it's M from melanin and mood color. So think about compare pale versus tan skin. Some numbers of melanocytes are different melanin output. Number 3, secret cell, it's a Langerhans cells. So it's a dendritic immune cells are scattered in the epidermis. The function is to recognize foreign substances and active the immune system. It's like the guard of the skin. It's involved in the allergic contact dermatitis. So L, it's from lockout immune cell. So it's like catching a pathogen intruder. The number 4 is Merkel cells, which are specialized in mechanoreceptor cells in the basal layer associated with nerve ending. The function is to detect the light touch or texture. So the origin of Merkel cell carcinoma, it's rare but kind of aggressive. So think about if your hand, it kind of signal sent to the brain when hand touches, or brushing across the surface, a signal to the brain because it's a light touch. The number 5 is fibroblast, the dermis layer. So what it is, it's a cell in dermis that makes collagen and elastin fibers. And the function is to give skin strength, structure, and elasticity. So loss of collagen leads to wrinkles, slow healing, something like that. So F from fibers, flexibility. Think about before and after of wound healing showing collagen. The last one, the 6, adipocytes, the subcutaneous layer. It's a cell storing energy and cushioning organs. The function is to isolate, protection, and temperature regulation. So A is to absorb the shock. Imagine that the yellow fat layer beneath the skin is like a soft pillow kind of effect. So the key is to protect. So protection, pigmentation, perception, and repair. All skin cells form like a team. So keratinocytes protect, melanocytes color and guard against UV, Langerhans defend, Merkel sense, fibroblasts build and heal, adipocytes caution and isolate. So these are my all 6 secret cells that they work together. Thank you for watching. See you in the outline.